All right. Good morning, all. Welcome. Happy July 19. That frightens me. Is anybody else frightened by that date? Yeah, I don't know. We're midway through summer, but anyway, thank you all for joining us. We have a 2-hour meeting today, so I'm going to talk really fast. I will go ahead and start with roll call. So if you all will just go ahead and be ready to say here when I go through the names, that'd be fantastic. Dawn Alexander.
Here. Hi, good morning.
Good morning. Yolanda.
Here, good morning, everyone.
Hi, Yolanda. Kevin.
Here.
Wonderful. Samantha. No Samantha. Oh, wait, I do see Samantha on our screen. We're going to mark her here.
I'm here.
Carlos is absent. Ashley Chase. I don't see her yet. Jill Cohen is absent. Michelle Dossie.
Here.
Thank you. Jessica Daughter is also absent. Tara. Tara. Okay, we'll put a hold on that. Ida.
Here.
Jennifer.
Here.
Thank you, Jennifer.
Good morning.
Good morning. Leanna. Leanna? Sue, not here. Okay, Zane, I know you're here.
I'm here. Thank you.
Thank you, Nate. Adriana.
Here.
Thank you, Lori. No, Lori. Shayna.
Here. Sorry, Lori's here.
Lori is here. Fantastic. Shayna. Tess. Don't see Gina Lopez, who is substituting now. Welcome, Gina. She is filling in, or actually is taking over Colorado Coalition Against Sexual Assault. Welcome, Gina.
Hi, good morning, everybody.
Thank you for being here. Kristen Menz. Great, I see a hand. Michelle Murphy. Margaret.
Good morning, I'm here.
Good morning, friend. Good to see you. Colleen O'Neill.
Good morning, I'm here.
Thank you, Colleen. Sarah.
Here.
Thank you. Roshan. Brynja? I thought I saw her. Yep, there she is.
I'm here, sorry.
Hi. Nikki.
I'm here.
Fantastic. Kathy Wells is absent today. Donna Wilson.
Present. Good morning.
Good morning, Donna. Heather, who is substituting for Kelsey Wirth. Do I have Heather today? Okay, I do not see her. Jade.
Good morning, I'm here.
Good morning, Jade. And me, that is it. All right, good morning all, thank you. Moving on to our next agenda item, approval of the meeting minutes from June 7, 2023. Those should all be in your Dropbox. And so I'm just going to go to straight. Are there any edits or corrections that need to be made to those meeting minutes? All right, seeing none, if I could have a motion and a second, and if you would announce who you are when you make that motion, that'd be fantastic.
Apologies for being the dope in the room. Won't be the first time or the last. In my Dropbox, I don't see those meeting notes. Am I the only one?
They're in the Google Drive, not Dropbox, and I can drop that link in. And they're also in the email that I sent, so they're attached to the email, and that links to the Google.
I'll get them. Thanks.
Sorry, I had the wrong platform in my brain. I'm working
You're fine. You're fine.
Platforms these days. All right. So any edits or corrections to those meeting minutes? Margaret will let you speed read quickly. All right. Again, if I could have a motion to pass those meeting minutes and a second.
I move to pass the minutes. Dawn Alexander.
Thank you, Dawn.
I second to pass the minutes.
Thank you, Chris. All right. Is there anybody opposed to passage of those meeting minutes? All right, seeing none, those meeting minutes will pass. Moving on to our April 7, 2023 meeting recap. Just as a reminder, that is a recap of the meeting. It's really, as you know, a more robust summary, if you will, of those meeting minutes, and will be text, which will be used for this report. So again, we are putting this through a formal process of approval for the members. Having said that, again, the meeting recap was in your materials. Are there any edits or changes that members would like to have made to that meeting recap? Okay, I see none. If I could have a motion to approve that meeting recap and a second, please.
This is Sam. I'll motion.
Thank you, Sam.
This is Ida.
This is Adrian.
I will second.
Thank you, Ida. All right. Is there anybody who is opposed to the passing of the June 7th, 23 meeting recap? All right. Seeing none, my friends, that meeting recap will also pass. And Trace, that was really fast. I hope I did all right.
You did great. Amazing. And we've got everything taken care of. So that's awesome.
Excellent.
Something's going on with my camera. So I'm going to start the video again. Can you all hear me still? Okay. Okay, perfect. All right. So we're going to jump in because we're closing out today at 10 o'clock. We've got a lot on the agenda. You might have seen 2 panels consisting of members. And then we also welcome our friends back from Casey with an additional data presentation. So a lot to do. Take care of yourselves. If you need to jump away for a minute for a break, etc. We understand to grab some water or something, but we're probably not going to have time for an official break. And we're just going to get right through to 10 o'clock. So just a heads up there. So just as a reminder, the conversations are continuing around the effectiveness of mandatory reporting per the directive, and we're teasing that question out by talking to members with a variety of experiences and expertise. So we've talked to, mental and medical health professionals, right? Today we have what we're calling the provider panel, which you'll hear a little bit more around what that means, because you'll see that we don't really have a succinct definition of how all these folks are threaded together, but it's in there, and Doris will kind of talk through that in a bit. And then we go on to the education panel. Both panels have 3 members each. I sent out a summary. Hopefully folks had an opportunity to read through those, just a good baseline understanding of kind of where folks are coming from. But we'll touch on some of those questions that we already asked the panelists to just dive a little bit deeper on. Then we'll get into a little bit more of an organic conversation with the panelists, and then we'll also open it up to a Q&A with members. So just hang tight with any questions that kind of come up and towards the end of each panel. Doris is going to facilitate the first panel with providers. I'll facilitate the second with the education panel. And we've got about an hour, actually exactly an hour, Doris, that we'll split between the 2 of us, so 30 minutes each. And I can hold us accountable on the time side, so I might nudge you a little bit if we're closing in. And with that said, I will hand it over to Doris to introduce our provider panel.
Awesome. Thank you, Trace. So she said she would nudge me. It makes me think, like, am I a little bit wordy? Sometimes I am. Thank you,
No
Trace.
way, no way.
Okay, so we're kicking it off with Trace mentioned the provider panel. We're calling this group loosely kind of a child care provider panel. I'll let them introduce themselves in a moment. So we have 3 panelists today: Kristen or Chris Mentz, Brynja Segrin, and Zane Grant, who will be kicking off our conversation today around again these 3 questions around that we'll dive deeper into the reasons that folks make mandatory reporters make calls. We had our initial presentation now several meetings ago that identified concerns about the safety of the child, desire to connect families and children with resources and services, and then concerns about legal liability as the top 3 reasons for making reports. So we'll dive into whether that those 3 reasons hold true in your respective experiences. And then we'll get into, what might be some of the challenges and barriers in our current system, and then also what you might recommend for some improvements. So signaling to the 3 of you how we would like to frame up the conversation today. But before we dive into that, I think it would be important for all of you to introduce yourselves and then just answer that first question around why, in your perspective, your organization or professionals in this sort of child care provider, loosely held space, make reports to the hotline for child abuse and neglect. I'd like to start with you, Chris.
Hi. So I am a licensed clinical social worker. I have contracted in the schools to do social work, K through 12, behavioral, more so on the mental health side, as well as private practice. And I have a population typically of 4 through 18, 12 through 18 being more so my pop. 9 times out of 10, I'm making calls for safety reasons, or concerns or allegations that the child has led me to believe. So that would probably be most of the calls I make. Service-wise, I feel fairly helpless that I don't have services I can call in a rural location. So I live in rural Colorado, and there's not enough. If they don't meet demand by calling in, they're not going to get services, basically. So that would probably be the other issue. And, again, it's not to say rip these children out of your home. There's concerns here, parenting or whatnot. And so that would be the why.
Awesome. Thank you, Chris. Zane?
Good morning, Zane Grant. I'm a licensed clinical social worker. I started my career in 1997, I think, working in child welfare here in Pueblo County. And then in 2002, I took over the CASA program. So if you do the math, I've been at CASA for 21 years. I've done a lot of presentations in our community around mandatory reporting. Most of the calls that we get at CASA are from community members that are frustrated that they've made calls and they just don't feel like they're being heard by the people screening their reports. And so we take those calls at my organization. We don't take them, we refer them back to the department, but we do tend to hear a lot, an inordinate amount from the community that they're frustrated when they go to make a report. When I meet with mandatory reporters, I also hear a great deal of frustration. I've presented to both school districts about mandatory reporting, nurses, doctors. I've worked with hospitals on how to report effectively. And so that's kind of my role in this. We do have to make reports from time to time in my organization, but it's typically because a child, there's some concerns about maybe some re-abuse, because the children that we work with, they're already involved in the court system through child welfare. So sometimes we have additional concerns that we have to report. So in my years behind my desk, I've seen a lot. I've seen the good, the bad, the ugly. And the frustrations I think that come about. So my answers, I just would like to qualify. I think because I have a history of working in child welfare, I tend to feel that the department needs to kind of step things up a little bit with how they interact with the communities. It seems like child welfare just kind of happens in a vacuum sometimes, and I think a lot of the problems that we're going to try to address on this task force are really going to fall at the hands of the department to really kind of step up their game, so to speak. I don't mean to sound critical at all, because I know it's a very difficult job, and it was so please take it for what my spirit is intending it to be. I just really feel like if we're going to be helpful in this task force, it's going to be really helping change some policies at the DHS level.
Thank you, Zane. Brynja.
Yeah, so I'm Brynja Segrin. I'm the COO of Boys and Girls Clubs of Metro Denver. So we oversee soon to be 25 after school, out of school locations across 6 different counties in the Denver metro area. We serve about 2,500 kids per day, starting next school year, and indirectly and directly impact over 23,000 kids per year in the Denver metro area. I oversee our club operations vertical, as well as our safety and risk vertical, as well as our impact vertical. That includes our team of social workers. And so I would say, why do most of my team members end up making a mandated report call? And it's generally child safety concerns. Imagine an after-school program, a little kid running in after school or the first day of summer, safe adults, faces he or she or they recognize. And it's a really trusted place. So disclosures do happen. And generally they are related to physical, emotional, or sexual abuse concerns that are happening within the home. Again, our organization has made the decision to have social workers on staff to help support the reporting and triage of these claims. But that's unique in an after school, out of school environment. I would say navigation of community resources. That's always a really important discussion as a community organization and with our social work and club operations team of, is CDHS or the county level human services really the appropriate department or function to navigate community resources as it relates to poverty, as it relates to food access, all of the things we know people in our communities, especially our kids, are experiencing. And so for us, that definitely is usually not the agency. That is our partners, that is our school districts, that is our food banks. How do we act as that access point and really, really leverage CDHS for true safety concerns of kids?
Thank you for that. And I did not sort of plan the order. I was going in the boxes, the order of the boxes as they appeared in my Zoom. But I think that Brynja, you provide for a really good transition into my next question around, when we think about those 2 buckets of reasons that the 2 buckets around, like, services and actual child abuse or neglect, that when you're talking about physical abuse, sexual abuse, or emotional abuse, those reports making sense to go to CDHS. But that other bucket of other underlying needs of families that are about poverty or about access to services and supports that families perhaps should be able to receive outside of the child welfare system, what might be an alternative reporting mechanism separate from what exists today in Colorado, separate or different from what exists today in Colorado? And I want to start with you, Brynja, just because you're thinking in these different pathways sort of prompted the question in my mind.
Yeah. In reflecting and thinking about what could be, and I love spending time in that space, I do think there's a huge opportunity for the state to reallocate resources from just responsive complaints / claims and that true child protection safety, and talk about how do we build something that's about navigation, and how do we leverage and fund community partners that can be part of the process. I do think there's a benefit to having the state or local agencies oversee the navigation. But to navigate properly, there has to be connections with local community organizations. And so I think it's both. I don't think it could be one or the other. I also think that if we think prevention, if we think about strong families, if we think about great environments for kids, would that ultimately, in the long run, if we invest in those types of access, resource, and navigations, lead to a reduction on the safety concerns 10 years from now? That's where I would want to spend my time and space of like dreaming big of how are we protecting kids through proactive strategies and engagement of families. And thinking about the diverse community of Colorado, I do a lot of work with our Boys and Girls Clubs of Alliance of Colorado, and thinking about how do we leverage resources, ensure equity across the state, because every community is different. So I do also think like those statewide organizations or those statewide alliances have a really big voice at the table, to ensure kids in rural Colorado get the same access and service as kids in downtown Denver. And so I would summarize by saying, yes, it has to be government. Yes, it has to be community organizations. And then two, we really need to leverage the statewide approach to ensure equity.
Thank you for that. Chris, you mentioned, the reality in rural communities is that, sometimes the only way to get access to services and supports for families is by making that report. I'm paraphrasing. And so I would love to get your reflections on what Brendan shared, and maybe even some, additional thoughts that you have around the this idea of having an alternative route for kids and families that really is about accessing services.
I think she's right that in the sense I agree that it needs to be more proactive, giving resources. I think empowering your children is probably a bigger piece, but in a rural community, they're afraid to talk. It's always like, well, who's going to know? Who's going to know? Or like even like getting sexual health care. Well, that's my doctor and they know this, or they see my mom's best friend is in there as a nurse. And so there's this fear that everybody's going to know something. And I think we're about 25 years removed from society, which is really scary, in a lot of thought process. And it's very much anti-government where I live, as far as they want to parent without interference from the government. So I think it has to start with talking to the kids and recognizing that the kids need to empower themselves and advocate for themselves and put more resources in the schools. Or now we're just starting to do some training with our police. Well, I wouldn't even say yet our police, but our sheriff's services are starting to recognize the need for maybe a social worker engaged on a call, understanding mental health versus this person isn't blowing out because they're like, they're having a mental health crisis. So let's stop criminalizing it. The fact that with our kids, maybe Denver has put in programs where we have social workers in the library for the homeless. Well, we barely visit our libraries here, but if we have safer places where kids can go, where they can access resources and feel that their anonymity or they can get help, I think would be better. So maybe safe spots or something like that are community driven where, and maybe that's kind of goes back to them having a line to call and say, hey, I need a safe spot, or hey, I need somebody to talk to. I know we have the I Matter program in going on for mental health, but it's more than that. It's more like, I'm hungry. I don't have food going home this weekend. I don't, there's a lot of problems going on. Bed bugs, the kid comes with welts all over him. There's a lot of problems going on here and so few resources. Like we don't have any. We have some food banks, but we don't have availability of homeless shelters where we live, yet our population is starting to grow. So again, I think it goes with starting at the root, which would be our youth, and giving them the tools that they need to feel comfortable in making reports, whether it's emotional, sexual, neglect. And I kind of laughed because they got on this whole thing in school about the bullying. And so, my kid would come home, you're bullying me, Mom. And I'm like, no, I'm telling you what you need to do because I'm your parent. And I don't want it to go extreme. So I think it has to be very like 1, 2, 3, here's what you do. if this is happening or you need help, these are your resources, and take that to that extreme where it's very clear cut, simple language. And then we decide from there. I mean, I get that, again, we want to protect the anonymity of our people here. I get a lot of things that they don't want interference, but I don't feel our kids have the resources. A lot of this is driven by religion or cultural or, socioeconomic aspects of it, generational we see here. So it gets difficult when somebody wants to talk because they don't see any changes, or the system has already been involved, but there's no changes, or the system hasn't gotten involved and they have no voice, And so you have different scenarios, but I do think that if we could give safe spots or resource spots or something like that, whether it be local libraries or, mental health centers or just I don't know. I'm not clear how that would work at the school, but
For
I know
young
the-
people to access those services.
Yeah.
What would that, if that was implemented, right? Like then, like kids would have the ability to seek services and supports. What impact would you see of an approach like that on mandatory reporting?
I think at first it would be inundated. Honestly, I think that there would be a lot of calls. I think we would have to recognize why the calls were coming, or it could have the whole opposite approach, where they're not calling at all. I think it depends how we're giving that lesson to the kids or that education to the kids. I think that if the kids have a resource line, it's no different than the I Matter line that we set up, or it's no different than Safe to Tell line. We're telling that Safe to Tell, we can expand on that, but I don't think a lot of us know anything about it. And then we give this resource to the kids, but then it's not given to the parents. So the only reason I know about these things is because it was in school, but it's never been sent home that there's an I Matter program. It's never been sent home that there's a Safe to Tell program for my kid to tell anybody else. So I think it's about educating both sides of the fence. And with such limited resources, that becomes difficult. So maybe it's a task force that needs to go around to communities, especially those that have these barriers of resources. I'm not clear. Again, it's like, let's magically put resources there with no people. So it becomes difficult. So, yeah.
Thank you. Zane, you mentioned the need for, and for whatever reason, the acronym, I mess it up every time, CHSD, Colorado Human Services Department. I don't know why I got to say it like really close, really slowly. The need for there to be greater ownership on their part. But I want to sort of like talk more about what you've heard from mandatory reporters on, process, procedures, things that they're frustrated with, that might be helpful in thinking about ways to improve the system.
Well, first let me say, I think there's an overall lack of training for mandatory reporters in general. I know when I was, and again, I was in school in the 90s for my undergraduate and graduate programs. So I was never trained on anything related to mandatory reporting. I was just told I was a mandatory reporter. So a little bit of my bias in this is that I don't feel like we've done a good enough job just educating mandatory reporters. We have them listed, but when I go out and do trainings, I ask them, how many of you have ever had a formal mandatory reporter training, even though you're listed in the statute? And very few of them raise their hands. So there's that component that I think we need to change altogether is we need more training and support for mandatory reporters. The second thing that I see, and I echo a lot of what Chris has said and Brynja as well, because I see both sides of it. I have 8 counties. 2 of them are extremely rural, and they're resource deserts. But the other shift that Chris kind of alluded to is the families. I mean, people have got to want to participate. They've got, so there's that issue that we have to tackle and understand that there's a dynamic there that we may spend a lot of time and a lot of energy on this, but whether or not we're able to effectively engage families will be another issue. I think the third thing for a lot of the mandatory reporters that I see is, again, that fear of not reporting. Sometimes I feel like some mandatory reporters have said, we feel like we can provide the services, but we also have to report. And then that sets a dynamic with us and the family that is difficult. And, you know, I was the board chair of the social work licensing board through DORA. I'm the board chair right now of the unlicensed psychotherapy board through DORA. We have sanctioned licensed professionals for not making a mandatory report when those come through as complaints, because that's the law right now. I know our local district attorney here in the 10th Judicial District, which is Pueblo, has filed charges against mandatory reporters for not filing reports on time. So you know, there's this fear that mandatory reporters have that say, I know I'm supposed to report. And then the frustration is because of the lack of training when they go to report, they don't exactly know what they're supposed to say to the reporter. I mean, they have some general idea, but then they get a barrage of questions back from the screener, and that just seems to upset them and say, I don't have 45 minutes to sit on this call and give you every intimate detail that I'm not going to have about this family anyway. I'm just trying to make a report. So there's just, it's just not working like it should. So earlier when I said, you know, DHS has some ownership here, I think just because pragmatically speaking, I see them as our clearinghouse. I think I worry that if we get too far into, oh, well, you should go here for this, or you should go there for that, or this is actually a child safety issue, oh, but this is a resource issue, that's going to be too confusing for mandatory reporters. I think we need a repository where a decision is made. Is this a resource issue? Is this the safety issue? Is this, you know, a non-issue that we just need to educate? Because I also know the department gets an inordinate amount of fake calls to the reporting line of parents that are just trying to cause trouble for the other parent. Maybe it's a custody issue, it's a divorce issue. Grandparents are upset because they're not seeing their grandchildren and they want to call it in and try to force a parent's hand. So there's a lot of misuse of our screening system right now. Again, I'm kind of like Chris, it's so big that I don't know the solutions, but I can tell you what the problems are.
Yeah, thank you for that. I want to come back to something you said about, you know, when you are a provider of sorts, when you're working with kids and families, and something is disclosed in that circumstance, and you're a mandatory reporter, reporting actually can have an impact on your engagement and relationship with that kid and or family. And so I would love to hear from you just some of the challenges that you've seen and or experienced with that sort of conflict. And yeah, and I think I'll come to you, Brynja, for a response here on because I see a lot of head nods.
Yeah, I think it's a really important call out. And so Zane mentioned two things: that training is lackluster at best, and navigating that tension between what is my lawful duty as a mandated reporter, and how do I communicate with kids and families and continue to have that relationship. I think for our organization, we've invested more significantly maybe than other providers in talking about mandated reporting, talking about the impacts of making reports, and how do we have transparent conversations with families. If a kid disclosed something, we have to make a mandated report at some point if it is a safety concern. And we have to have courageous conversations with our families to say, hey, Johnny disclosed this. We know all this other context, we still have to make a report. I want you to know that we're following our protocol and the requirements of the state. How does that land for you? Give opportunity for feedback, give opportunity for the big emotions, incorporate some social emotional practices. And at the end of the day, it usually de-escalates. But again, that doesn't happen overnight. It takes tons of training, it takes role play. And that's a step we're taking because of the stressors from the system. And so that's not required. That's all like us trying to treat people like people and do well by kids, communities, and families. And so I think there are approaches to work around it. I think also, though, we always go back to the statutory language being vague and archaic. I think there's a way to create an opportunity for the gray, and make gray feel a little bit safer. And I really appreciated Zane's comment of like, it feels like they're just the clearinghouse, because it does, because the statute doesn't reflect the current nature of society of how are we doing things. So I do think there's opportunity to address in statute. I think there's an opportunity to address in structure. I think there's an opportunity to address in training. But also going back to the fear that Zane mentioned, how do we de-escalate fear? We have to create safety in the systems. And so there has to be some bystander, or possibly like, how do we manage liability in the gray? And I think that's just a really important question from providers to the state to say, we know this is never going to be perfect, but how do we navigate that gray?
Thank you. I think that is a great note to transition on to our second panel on with educators. But I wanted to just tease out really quickly what you said about, really looking at the law, but also looking at policies and procedures, and also looking at what training and supports that are provided, all in the vein of creating a different culture and safety around making reports when necessary, but also being able to ensure families have access to the services and supports that they need. All right, I think I'm going to hand it back to you, Trace, to introduce our second panel. But thank you all for a rich discussion. We're actually going to come to questions at the very end of both of our panels, and we'll have an opportunity to dive into to both groups and some of the questions that other task force members might have.
Perfect. Thanks, Doris, and thanks everyone for your participation on that. We're going to hop right over to my folks on the education panel, and I'm kind of also managing the tech. So I'm going to slowly bring you on to the spotlight. But if you could go ahead and start introducing yourself as I bring you on. I've got three folks with me, kind of an all-star lineup in my opinion. So I'm excited and honored to hold space with you all and excited to get into this conversation. Michelle Murphy, I'm going to start with you if you wouldn't mind just saying who you are and what brings you here and why you're excited for this conversation.
I can't start my video, but that's a much prettier picture than my smiling face. So I am Michelle Murphy. I am the executive director of the Colorado Rural Schools Alliance. I am also an attorney, and I serve as general counsel to a number of our small and rural school districts. There's my friend Colleen, good to see your face, to our small and rural school districts. So I'm also a trained social worker. I have an MSW from DU, and I did social work in schools for a time. So I come at this from like just a complete, Colleen knows, heart space, and also legal space, and also real increased awareness from this group about how common our concerns and issues are. Trace, it would be great if you could get my face up just to say.
I can't spotlight you until your video's on. So if you turn your video
well, it is. It won't. Oh, okay. Sorry.
There we go.
You can't start it, it says. But anyhow.
Now you're
there I am. There I am. So I think that's what brings me here, is just a real commitment to this issue and a real understanding of the importance of the written word in statute. So not everything belongs in statute, less is more, all of those things. So just really wanting to be involved in that process as well.
Cool. Appreciate it, Michelle. Thanks for being here. Dawn, I'm going to hand it over to you.
Thank you. My name is Dawn Alexander. I'm the executive director of the Early Childhood Education Association. We're a statewide trade association that supports licensed childcare providers. And so in full disclosure, the cases that I probably hear about are the extremes, are the ones where things are going very, very wrong, right? And we are losing professionals because of the interactions with their county departments or or the mandated reporter requirements that they have with the state, with CDEC. In our industry, there is no discretion. There is no gray. If there's even a hint of a possibility that this is something, they are required to report. And if they don't, there will be licensing violations that could put them on probation or force them out of the industry altogether. And so we are seeing a lot of industry harm coming from the requirements. Our population has to do annual trainings, virtual trainings on mandated reporter regulations, which is fine. But when it comes down to it, none of that information is very relevant, because if you have any suspicion, you just must report. And I started in this profession as a licensed family childcare provider. I became a licensing specialist, and now I'm the advocate in the industry. I have all of these different perspectives to bring to this. And I know as a licensing specialist, the day I decided to leave that profession is when I was told by my supervisor, who reviewed a report that I did, that I needed to go back and cite a program because they didn't report something that I felt was very much an HR training opportunity for a new staff member. And they didn't report that as abuse or neglect. A new staff member had put a leg over a child on a mat as they're sleeping, trying to calm their body and help them go to sleep. And because they didn't report that as abuse and neglect, my supervisor made me go back and cite them for that and force the referrals. And so, much like having families that can cause a lot of harm to a program. Yesterday, I was talking to a program that closed because they had a staff member. Okay.
Sorry. No, I'm
Yep.
just gonna jump in real quick because I want to make sure that we get equal introduction.
Sorry.
No, you're fine. I really appreciate the passion you're bringing in, the variety of perspectives, but I got to drive us a little bit. So appreciate you being here. Colleen, I'm going to jump over to you and then I'll kind of open it back up and Don will have an opportunity to come back in. Go ahead, Colleen.
Absolutely. I'm Colleen O'Neill. I'm the Associate Commissioner of Educator Talent at the Colorado Department of Education. I come to this position as a teacher, a school administrator, and a district administrator under Human Resources. And so I have a very broad perspective around our mandatory reporting requirements, what that means for teachers who spend 7 to 8 to 10 hours a day with these students, at least 184 days out of the year. So those are kind of the perspectives that I'm bringing to this conversation as we launch into our panel.
Appreciate it. Thanks, Colleen. The thing I'm excited about with the three of you all is that there's clearly a big thread with the education piece, but you all are kind of playing in very different spaces. So I'm excited to kind of like hear the unique challenges, but also, Michelle, kind of what you mentioned, like also there's a lot of commonalities, both across the education space, but also across all these other spaces that we've been hearing from. One thing I'll jump in on that I want to kind of like quickly note is, so when we sent out the survey that folks responded to on the panel that you all saw, I know, Michelle, you were kind of like, well, how does this compare? About the 20% of calls are from educators. It's high, right? I think the thing that everyone else responded to that made sense is what Colleen just said. You are, as educators, probably with children more than any other field could be because of the hours in the day that kids are at school, right? So that was kind of a simple answer for me of like, yeah, this number feels high and we're with kids like a lot. So I just wanted to just name that seemed to be the kind of thread there as far as why calls are high on the educator side. But I wanted to give an opportunity real quick if anybody has anything to add to that as a nuance, or would you just say that is really where you're kind of landing is like, yeah, that makes sense because we're with them all day long, every day.
I would just offer that, yes, that was a lot of my response for sure. But I would also offer that in some cases, educators really default to the well-being of students and are told to default to the well-being of students often. And so out of, especially some of our new teachers, out of fear of unintended consequences, they report probably a little bit higher. And I need to look at the data better, but report pretty high because they are just concerned and don't know any other resources or availability because of some of our training. So I would just add that context around there just a little bit in that high 20% count.
So kind of bringing in that, maybe also what Zane was referencing with the training piece, that's a challenge. You've got a first year teacher who might be overwhelmed, for a variety of reasons. And then you throw in this, this kind of situation where they're like, I don't know what to do, but I also know that I don't want to, kind of be in over my head here. So I'm just going to make a call. Is that kind of like a scenario that you would, or maybe not a first year teacher, but a young teacher who's just like generally overwhelmed?
I would preface that, yes, without that depth of training, and I appreciated Zane saying that depth of training, we default to, we're going to report it. We're concerned. We're going to report it.
Well, I would add that I think there's, in my mind, maybe that number isn't so high, but I don't really do math and numbers make me a bit dizzy. I often, I do a lot of these trainings and I agree with the comments that they're lackluster at best, and people, bottom line, they don't know it when they see it. And I've been in circumstances where I do a training and 2 days later, a superintendent's calling saying, hey, I'm being ticketed by law enforcement, brings all the pieces of the conversation in because I didn't report this sex assault that we looked at the tape and it didn't happen. And I'm like, you didn't report it. I just told you. They're like, oh, that's child abuse too. So it's really hard that the pace that these folks deal with things, and to Dawn's point, like, their proximity and closeness to kids, like they just don't know it when they see it. And then the responses can be they create more problems locally to what Dawn spoke to as a big part of that. Why, like, reporting creates more problems than it solves sometimes, I think may be a perspective.
And if you have a staff member who wants to kick up some dust and cause problems for your program, they may not accomplish it the first time, but the second time they call, they certainly will. And they will get the engagement that they need. And I have that program that I started to tell you about that closed down. They closed down, and because all of their staff left over all of this uncertainty, and the only people that were on staff was the director, her daughter, and this person who had made the report. And she's like, I cannot continue to do childcare with this person on staff. I have no recourse to fight them. She closed her business, and Boulder is out of a significant program that was having tremendous impact for families. And I know other directors that have just recently left the industry over expunged allegations, right? Expunged. And because the pressures that it causes internally in their programs and stuff, they just say, I'm done. I can't do this anymore. So we are losing people who are passionate about serving children, and we have to fix this so that reason can enter back into the equation, and we can keep professionals in the industry.
Thanks, Dawn, for that. I think, so as I think about the remaining time we have, I want to make sure that I'm just getting really clear on two things. One, like challenges as you see it, and two, opportunities, right? So let's just drill down. You've kind of, we've scattershot a little bit on the challenges piece, but I want to give each of you an opportunity to answer really explicitly around, from your perspective, your experience. Colleen, you mentioned, and I'm sure all of you have the experience of, like, you were a teacher yourself, but also you work and support teachers, school leaders. Michelle, I know you're talking about superintendents, right? So you're thinking about all of those folks and all the different layers that they're representing. From your perspective, what are the biggest barriers or frustrations for those professionals in making the mandatory reports? There were a variety of answers in the survey. You've talked a little bit about them here, but I just want to give you kind of a platform to just say, here are the biggest barriers and frustrations. So Michelle, I'm going to start with you if you don't mind.
Well, I think I'm just echoing what folks said earlier. The absence of a safety net, a resource net, a support structure we call, and quite literally, sometimes it goes into like the ether. Like, we don't hear anything for weeks. We've got employees on leave or parents wondering. It's just really, really concerning. I think for school employees, and I'm talking about in this context, teachers, principals, superintendents, school board members who often don't know they have the obligation, they're mandatory reporters as well, is it becomes punitive on them because of their ongoing relationship with the parents. they have to, their anonymity is important, and or at a minimum, no further engagement. To somebody's point, make the report, get the details from the people involved. And they're often called subpoenaed as witnesses in either DNN proceedings by the county or private divorce proceedings. And oftentimes I'm lucky and I'm able to keep them out of that. But to have our staff engaged ongoing in legal disputes involving our families is untenable, especially when the reports themselves are supposed to be confidential. I understand that in rural communities, that's almost impossible. And most communities, they're gonna, that's almost impossible, but there is no way they should be bound to any further legal, if they want to, 100%. But the subpoena piece needs to be, I think, in my mind, addressed as well. And then trainings we need, and we are committed to and building out trainings for rural schools. So contact me, anybody that work, I think Brianna, sorry, I don't know how to pronounce your name. There's meaningful conversations around the reporting process. Once we have a meaningful safety net in place, feels really right and a sweet spot for folks.
Appreciate that, Michelle. And thank you for getting specific on those pieces. So Colleen, I'm going to come to you next with the challenges, frustrations from your perspective.
Absolutely. I will underscore everything Michelle just said, for sure. And then I'll take it one more step farther and talk about the fact that a lot of our teachers or our mandatory reporters, principals, teachers, superintendents, board members, don't actually understand what any alternatives could be. And it doesn't seem like there's alternatives in this space. And my example is when I was at the district level, I had a teacher mandatory reporter that was concerned about the amount of food an individual was getting, a student was getting, because they seemed really hungry all of the time, only to find out that their parent, their single parent, was going through cancer treatments and unable to literally get up in the morning to help them. And so they're lacking the opportunity to dig a little deeper. There's just a one quick hit of report it. And there's not a clear opportunity to dig a little deeper into the why before it gets reported. And that was something that obviously this parent didn't need to have in their life, undergoing cancer treatment in addition to everything else. And a few quick questions, the student was actually embarrassed and didn't know how to explain that his mom was super sick and didn't understand how to say that and verbalize it. And so it just kept coming out as I don't get food. And so I think there's just more that we can do in the system. And that's my best hope, is that there's more we can do in the system to help our educators be more prepared, to ask critical questions before we just kind of jump into mandatory reporting in a situation that may not necessarily deem it.
Yeah, and Colleen, I'm gonna put a pin in that for us too, because when we get to the opportunities piece, I want you to tease that out a little bit more around specific ideas you might have around what either the critical questions piece, I think, is one to hang on to, but then what other pieces could we bring out there? So appreciate that. Dawn, biggest barriers and frustrations from your end and your perspective and your experience.
I think that the rigidity of the system when it comes to childcare has been significant. I think that it's probably come because of inconsistencies from county to county to county in terms of what they would respond to. So it's probably made CDEC be far more rigid about everything must be reported. And so that for me, if that could be cleared up, because it doesn't just result in a county investigation, even if everything is deemed unfounded in that report, it always is followed up with an additional investigation from licensing. So every report means that it's going to be 2 investigations where licensing concerns are now being evaluated. And frequently, because the county was involved, and even though it was unfounded, they still move more towards the possibility of placing a program on probation. That means visits at least every 27 days, usually for up to 2 years. And that's a process that undermines business and supporting children.
Thanks, Dawn. Appreciate each of you giving really specific examples of kind of the challenges and the consequences, right? And that's really what we're talking around, is how does this impact families? How does it impact staff, right? We know we're in a teaching shortage. So Dawn, when you're saying that people are leaving because of these experiences, right? Like that's something also that I know is at a variety of conversations right now across the state and across the country around how we keep folks in the profession. I also, so let's flip to this opportunities piece. Colleen, I'm going to come back to you. I'm seeing you're getting some love in the chat around your example. You gave one piece around, you know, kind of critical questions. I think you and Michelle have really talked around the training piece. I don't want to put you in that corner and say that that's the only alternative piece. And I know, Michelle, you've also talked around the safety net. So I want to kind of get your thinking on that around what would that look like. But Colleen, like, what opportunities are there? Obviously, we're talking around the example of not intervention or removal, right? We're talking around the example of when there is an opportunity for resources, when there is an opportunity for additional training. What would you like to see this group really kind of coalesce around that would support educators?
Yeah, I mean, I'll say the first thing is that there are reasons mandatory reporting exists. And I think that's important to keep in mind, as well as the reasons that it is hard across the continuum. And so I would love to see mandatory reporters become mandatory supporters, if you will, rather than necessarily mandatory supporter or reporters. One of the challenges I think we have is that we report rather than have conversations with caregivers to get some more information. And that's a really sticky situation as well. But is there a way that we can create a system where we are really clear about implicit biases? We know we carry that into the way that we make critical decisions around mandatory reporting, but we also, is there a way to create a system where we can give caregivers a call in certain circumstances and have really good training around what that looks like in certain circumstances, rather than a kind of immediate mandatory reporting conversation? I'd also say that we haven't, but also help our families better understand what mandatory reporting means. So not just training our teachers, our principals, our superintendents, our district staff and board, but also really having conversations with our kids about what this means, having conversations more and better and understanding how to do that with our families and their caregivers. And so that they understand the whole context of that. So I would say those are a few of the things that I would be hopeful we can come to kind of a consensus on as we think about that, the tools that we have at our disposal going forward as a task force.
Thanks, Colleen. Going back around the clock, Dawn, I'm going to go to you, and then Michelle will end with you on the opportunity. Then I want to open it up for questions for kind of all panelists across the board. So go ahead, Dawn.
So I think that we have infrastructure we determined last month that could support families, right? We have family resource centers. We've got early childhood councils that are in place for all children birth to the age of 5. Those systems that are in place could have an expanded responsibility to support families if we thought really creatively. And so I would like to see, rather than the creation of something new that then to be developed and funded, why don't we repurpose some of these organizations and structures that are in place? Because now another layer has been added, the local coordinating organizations that support communities when it comes to preschool, and is supposed to do some redundant stuff between what the early childhood councils and local coordinating organizations are supposed to do. So we need everyone at that table to really discuss, how do we repurpose some of what the funds are applied to support families.
Dawn, you're blowing my mind over here. You're like, let's not create new systems, right? Let's look at the ones that are already in existence. I'm hearing that at so many tables I'm talking around. Let's look around and let's see how we can do better partnership, deeper funding, those sorts of things. So you were not alone in that sort of suggestion. I appreciate you naming that explicitly. Michelle, bring us home. Opportunities.
Sure. Yeah, 100% redefining the process. I love mandatory supporters. I'm putting that in my training.
Yeah.
I love that 100%. I love what you're talking about, Dawn, around reorganizing what we have in place and the individuals we have in place, but be thoughtful and invite everybody to the table, right? Because we do it to people all the time to get rid of those silos, because they're hurting kids and families, especially in an environment of scarcity. I think it's a huge workforce development opportunity. We've got to get, for us, rural kids interested in the jobs in rural communities. There are jobs in rural communities, just that the kids, they're not exciting to the kids, but they could and should be if and when the system redesign is in place. And we need them to do it, right? It's their world, not ours. I am very old. We need like new blood advising us along the way. And then, yeah, I think those pieces around just what this group is designed to do around the reporting process, taking the fear out of it, making it make sense, who, when, why, how, all of the things.
Appreciate that, Michelle. I don't know if I agree with the you're very old, but I saw some laughter across the group. So appreciate all those points. You all were fantastic. I knew this would be I appreciate the specific examples that you gave and kind of these broader ideas that we can really chase around once we keep going in this task force kind of further down the road. But right now we're still listening, right? So I want to open it up to the rest of the task force. We've got about a little less than 10 minutes for questions. So again, we've heard from our kind of provider panel, which was again pretty broad, in our educator panel. But I would love to hear either connections you've made across the group, some of those commonalities, things that kind of stood out to you, or questions you have for panelists. So I'm going to take us all off of Spotlight, bring us back to the full group. If you go to view and gallery up at the top, you should be able to see everybody, and would love to kick it to the group. Who has a question or comment for folks? Go ahead, Sam.
Sorry, y'all, my camera sucks today. But I'm just wondering, something I heard in different ways was the importance of just lessons learned over time from like year 1 to year, 10. And so I'm wondering how, or my thought or question it kind of is, what does mentorship look like for that new provider, that new educator from the older providers, the older educators? How are we building in an opportunity from lessons learned in the field?
Yeah, Sam, that's a great question. Colleen, I saw you come off mute and I was actually going to come to you with that. I'm curious. Go ahead, Colleen, and then I think Michelle possibly too. Go ahead.
Yeah, I'd love to hear Michelle's take on this as well. I would say we don't spend a lot of time on our mentor supports. 100% transparency. Our school districts, the Colorado Department of Education has certainly put together a lot of mentor supports, but those are reliant on our school districts. So I think this is an opportunity for us to make some recommendations around what we're doing for all of our teachers. Mandatory reporting is a required training for everyone, but that's something we could probably lift up in different ways to help our teachers have a better connection through their mentors, especially our early or our new to the profession teachers, our early career teachers, to help them understand what that system is. But that's definitely reliant on us to lift that training up and have leaders in our buildings and our districts that really understand the system well, to lift that as well as they're supporting their new teachers. So I think that's an excellent conversation. I just wrote it down as something that we could kind of mix into our training. Michelle, do you have something on that one too?
I actually put myself on mute when, but I'll never miss a chance. That makes me, when I hear those comments, I agree around the value in mentors, and I agree to the extent we can stipend that role, because teachers don't have a lot of career ladders unless they go to be an administrator beyond their time. So to give them more responsibility and ability to shine in their craft would be fabulous. But we don't need a designated mandatory reporting liaison in our districts like we like to do in statute. We don't have staff or capacity for that. It will make people's heads spin. Like, I don't mean to belittle legislative efforts or language. I'm just begging you, please, that's not the way to go about doing something, a great idea like what Colleen just put out there.
Because that creates system rigidity, right? And
Thank
then
you.
that rigidity starts to strangle the industry and then undermine programs altogether. Yeah.
Great word. System rigidity.
Brenya, go ahead. I'm seeing your hand up.
Yeah, I think system rigidity is a really strong call out in regards to how do we create opportunities and access to lessons learned and mentorships, even through informal processes within organizations. And so we do a lot of scenario-based training and scenario-based review based on lessons learned from either the year prior, or maybe it's a really just complex situation that we ended up having to navigate. You know, it's going to happen again sometime in the future. So how do you build that scenario-based training? Obviously, if you build it from a scenario, you can maintain confidentiality, you can keep privacy tight. But again, informal system of that type of training, practice, incident debrief, that seems to be a really good learning opportunity. In my director levels at my sites, I have folks who have been in Boys and Girls Clubs for 43 years. I have folks who've been a director for 1 day. And so also, I think I've heard providing those folks who have been through it a few times, that leadership opportunity to teach and guide. I think organizations can take on a little bit of the responsibility of thinking, how do we talk about lessons learned too?
Yeah, and I think, Sam, fantastic question, clearly lots of great ideas and thoughts around this. And so I'm just going to make a note for our team too, that's something that we can kind of dig into further, and like what opportunities are there for that sort of learning in each of these different professions, so that it's not just on the training piece, right? Like an actual training that you get, but opportunities to really understand, like, what does this actually look like? I'm thinking, you know, with my former teacher and school leader hat on, when we do mentorship opportunities, we make it all about instructional best practices, right? And so, like, how also do you, now family engagement is a hot topic, but how do you like put this up the priority list when it's so long just been kind of a tack on into those trainings? So just some things swirling around. Really appreciate that. Got time for another question or two. I want to throw it back to the group for any questions you have for our panelists. Or thoughts, connections.
I just want to clarify what I put in the chat in response to the idea around mandatory retraining requirements around licensure renewal. That's another really common statutory approach. And we now have layers and layers of different training hours, including the training hours that we're required to do. And we're already required by, schools are already required by statute to do trainings around this. It's the value, it's the quality of the trainings, it's the relevance of the trainings, it's all the things that Brianna, I'm sure I'm butchering your name, is talking about here. So I'm really excited because I think we have a meeting coming up to build that out.
It's Brenya, right? Yeah, there we go. So now we got it.
Yes, it's Brenya. Thanks,
Yeah.
Mom.
I love it.
Thank you.
And Donna, I love that you put that in the chat. I think that's what I was trying to get at, where it's like, we're talking around systems change, right? And we can't just say there's a training, and so we've changed the system. Can you speak a little bit, give a little bit more context to your comment there? Really appreciate you putting that in there.
Yeah, I can. I think, training is first order change, right? Like, and I think our system is focused on compliance. I think I talked about this when I was on my panel. We need to go beyond compliance. We're talking about true systematic change. We're talking about being able to implement, I don't remember who it was that said, instead of being mandated reporters, being mandated supporters. Love that, right? Like, how do we go beyond just like being compliant on, well, I fulfilled my duty and obligation as a mandated reporter and I made the report. What happens beyond that? So I think we get caught up in like, let's just send people to training. No, it's about the application of that training. It's about changed behavior, and training is just the first step. We got to go to second order change here.
Love that, Donna. Thanks so much for calling that out. And Colleen with the viral mandatory supporters, not reporters. I think the people are loving it. So appreciate that. I'm going to go back to Stephanie and then Brenya. Go ahead, Stephanie.
Yeah, I just wanted to support, what Donna has said, and I think others have as well. Right, it's about cultural change. It's what we call it. Right. And so I just go back to, in 2013, we had our first, statewide hotline campaign, right? And we spent a lot of money. I was actually part of all that stuff, right? We had marketing campaigns that said, you pick up the phone, we'll make the call, right? So we implicitly told people, don't think And now, right, we've seen what's happened after almost a decade. When we say don't think, we're like, actually, maybe it would be helpful if you could think, right? And so I'm going to steal my friend Michelle Dossie's wisdom, because we had a great conversation a few days ago. But, she said we need to empower our communities again. To be thinkers, to ask questions, right? And I just wanted to emphasize that is part of the cultural shift, along with all the other things. But you can't have a campaign like that out there and then expect different behavior by the reporters that are supposed to be regulated by the law. You can't have those things. The state's training is identical. It mirrors that language, right? Again, no fault to be given here. That's what we thought a decade ago would help kids, right? More reports, more help for kids. What we've learned, right, is there's this over breath now. The net was cast too wide. So no blame. Hey, I was a professional during these periods of time and contributed to many decisions as well that probably led us to the point where we are. I accept my share of that. But again, I think there is a cultural shift. It's not mandated reporters, it's mandated supporters. It's marketing campaigns. It's the whole bit. So just want to echo and add lessons learned from how we've managed to get where we are today.
Yeah, Stephanie, you took my comment. I was just going to emphasize that while I do talk a lot about training, I really think culturally safe system is, again, the first priority of what we're trying to tackle here. And for us, I see local organizations and a lot of community organizations leading the way on creating safe systems, even in the existing framework of the law. So how do we learn from that and inform the work and inform the change? So I just think it's a huge opportunity. And I come from the place of, I do think our organizations can help lead and help inform change really significantly.
Thanks, Brynja. I'm loving this conversation right now, because what's in the back of my head is that when we have to write a report around what this group is really coalescing around, is like we're getting to the real heart of this group and what folks are really getting excited about and thinking through and what challenges they see. So just really appreciate the conversation we're having today. I feel like there's some great momentum there. Leanna, and then Jennifer, and then we're gonna wrap it up and move on to the beautiful data discussion that awaits us. Go ahead, Leanna.
Thanks, Trace. So I'm hearing this theme from the panelists that there's like a disconnect between the person who makes the report and then the person who investigates the report, right? And particularly, Dawn just made a comment that, the person who reports says, once the county comes in, there's like no communication, there's no meeting of the minds around like what was reported, like why was it reported, and what was the context. And there is a lot of like legal liability concerns when people make a report, and then the person who's actually investigating doesn't understand, what the goal was there. And so I'm really just trying to get a sense from the panel, like, do you have any thoughts on how do we bridge that gap? Like, is it a matter of, yes, you can increase training for the people making the report, you can increase training for the people investigating, but how do we get that conversation happening? And I think Colleen was talking about it, particularly with that example about the child whose parent had cancer. It's like, how do you have that conversation between the person who made the report, given that there's confidentiality and all of that, and the person who's investigating, to make sure that all of that context gets communicated, and how do we address that disconnect?
Thanks for that question. Anybody on their panels want to give a stab at? Yeah, go ahead, Michelle.
I'll take a hit at that because I share that concern. And I know that there are some communities doing really great work about bringing at least DHS, law enforcement, and schools together, at least. Mental health center for like initial and ongoing conversations around what are we going to do and how do we do this and how do we train our teams. And some folks in the suburbs they're bringing their educators to panel discussions with law enforcement, DHS, and sort of the legal component, and really getting a better understanding of the process. And here's what you can expect. Well, that's not happening. So I think some of that's in its infancy, and all our hands are tied with limited resources, but it really goes back to restructuring the system? That's a great question.
And I'll underscore that just a little bit, Michelle, because I think it's about relationship development within your communities and knowing who the players are. That's been one of the ways that we've been able to tackle quite a few large scale issues within the education realm, is learning who those people are, developing those relationships, making sure that our districts are well connected to the surround and supporting systems and how they work, so that you know who to reach out to when something doesn't seem right, or something you have questions, or you just need to understand the next step. So I think we can take a lot of lessons from what Michelle just said there around that development.
Thanks, Michelle and Colleen. Brenya, if you wouldn't mind, I'm going to end on Jennifer. If you'll put in the chat whatever thoughts you have, because then I'll have to pivot us. So Jennifer, bring us home with your last question or comment, and then we'll move on.
Great. Thanks, Trace. Well, I just wanted to, first of all, Stephanie, I'm going to let you off the hook on I think we did this 10 years ago when we created the hotline. The statute is read the same way long before that. And the last time we made a change to the statute was like 2010. And I'm not going to get into what that was because it's not really relevant here, but the statute itself does not give discretion to mandatory reporters. And I think we overlook that a lot. It says if you know or suspect, then you have to make a report. And I think that is really where we get into this problem where reporters are first and foremost being forced to think about I have an obligation to make this report, whether or not I think it's going to have an impact on this family, whether or not I think this is going to result in something positive or negative for this family. There just isn't discretion. And as somebody who's been a mandatory reporter off and on for almost 30 years, I have trained and been taught this whole idea that you report, you don't investigate, you don't ask follow-up questions, you don't try to decide, whether or not there's enough information. That is for the department to do. So I feel like the statute is a place where we really need to focus some of our attention.
Thanks, Jennifer. Appreciate that. And with that, going to Zach Morris, timeout our group. That might be just me, an 80s kid, 90s kid. I'm like, wrong group. Does everybody get Zach Morris timeout? We are going to move on into our data discussion. And first of all, I want to just give a quick round of applause to our incredible panelists. Thank you all for that. What an incredible discussion. And thanks for members too. The rest of the members just jumping in. That was a great talk. Doris, going to hand it over to you to introduce the next piece of our agenda.
Awesome. Fantastic. So we're going to round out this discussion with these two sort of kind of broad categories, but to dive into the data, as you may recall in our last meeting, Casey Family Programs introduced this amazing data tool that they have that can look specifically at Colorado data and then dive into specific reporter types, and then track that data across the continuum of decisions in the child welfare system. There was some additional asks in the discussion last time around looking at rural versus urban, and diving into the data even in a deeper way. And so I'm hoping that we can have a rich discussion both on what the data looks like, and then also provide some of that input reflected back in how the data is presented today. Steve Ellis, I'm going to turn it over to you. I didn't see.
Crystal's here too.
Oh, she is? Okay. I was looking earlier while we were still having the discussion. I didn't see where she had joined. So we're going to have Crystal Ward-Allen and Steve Ellis join us for the discussion on what the data looks like for these two reporter types.
Thank you. Crystal, I saw your hand up. Did you have something you wanted to say first?
No, I was just trying to get her to see me that I was here. Thank you. I'll let you take it because you're the expert. And guys, I just wanted to say I loved all of this discussion.
Yes, very much. So timing wise, how much time should I spend going over the slides? Because there's a lot. We could spend a lot of time, we can spend a little time. So you want to give me a little bit of direction that way?
Yep. So we've got about 15 minutes for you to present. I'd say 15 max, and then we'll open it up for questions from there.
Perfect. So I'll go ahead and share my screen. I am disabled on screen sharing. Is someone able to enable me?
Go ahead and try now. Sorry about that, Steve.
No worries. There we go. And are we all able to see the screen? I think so.
You're good to go.
Okay. So for those of you that were here last month, a lot of these slides are going to be the same slides, but we're going to kind of go through them a second time. One, just let the data sink in a little bit more. Maybe you have different reflections of the data, maybe you're viewing it through a different lens, but also we have different people in the room that did not see the data the first time. So I think it's definitely well worth to spend some time kind of going through it. And additionally, as we go through this data, as it was mentioned by Doris, I now have added in some disaggregation by these rural or the urban counties. So the slides get kind of busy. And I apologize for that piece. I do believe there's a PowerPoint that's accessible that if you wanted to spend a little more time on the PowerPoint to try to look at the data to absorb a little bit, you can have access to that as well. If not, I can get you that PowerPoint. But don't hesitate as I go through this. If something jumps out at you, you have a question, you're a little confused by it, to just come off mute, holler, because I won't see chat. So Crystal or David, I think David Hansel's also on from Casey. So either one of you can just jump in as well and tell me, hey, Steve, there's a chat. So please. So let me move some stuff out of the way so I can go through here. Great. Okay, first and foremost, I want to kind of just ground us a little bit on what this data is. Casey Family Programs receives both the AFCARS and the NCANS data sets from the state of Colorado directly. And this data that we're going through is all from the NCANS data set. And the NCANS data set includes all children that were accepted for an investigation by the state agency, and then follows them through disposition. Was it a substantiated, unsubstantiated, alternative response type of programs that were implemented? What it does not collect.
This is trails data. So if you're in Colorado, you know it as trails data.
Thank you, Crystal. What it does not capture are screening decisions that were screened out. That if you go to a child maltreatment report, that you can find that on the web. Colorado reports about 2 out of every 3 reports are screened out. They never get investigated. So that means 1 out of every 3 is pulled in, but a vast number don't even come in at all. And so maybe some of that, as we go into this, may come into play, especially around those childcare, because I'm listening to, it was Dawn speaking about how that they just call in lots and lots and lots, but what we'll see in the data that there's a very few percentage of childcare providers that actually get accepted. So I wonder if a lot of those kind of get screened out.
And I just want to add, Colorado has a red team that a lot of these screened out reports are discussed by the agency and by a team to make that decision.
So the other piece I'll add in, besides the urban and the rural counties, at the very bottom line there tells you which counties went into my urban disaggregation, is the race and multi-race children. So when you see the data disaggregated by race and ethnicity, first, you'll only see races displayed that have at least 50 children in care. So you won't see all races displayed there. You will also see a multiracial category. And just for your back of your mind, in Colorado, the multiracial children, which are about 200 kids in care, about 80% of those are coded as both Black, African-American, and white. So the majority of those are biracial Black, white children. So let's kind of start and think about the system as a whole and thinking about disproportionality and disparity throughout the system. And then we'll kind of pull it back and look specifically at those children that are involved in investigations. This is kind of a standard kind of go-to slide that we use at Casey to look at how decisions points within the system and how disparities kind of manifest throughout that system. You see the very first column is the general population. So in Colorado, what is the breakdown by race, ethnicity of general population? And then you go across looking at some key markers. In a system that might be considered kind of equitable, you would hope to see roughly the same percentage in the general population as you see in each of these points. So if 5% of the general population is Black African American, you would kind of think that maybe 5% of Black African Americans are screened in and 5% are intercare and 5% age out. But as you look at the Black African American population, and I'm focusing there because that's primarily where you see the overrepresentation in the system, you see right away that you're twice as many kids are in the screened in population as the general population. And that kind of gets bigger as you go through the system to the point that you're 3 times as many kids aging out of the system that compared to the general population. So now like I mentioned, let's kind of pull back and think, focus on the children that are screened in for an investigation. So the dark line that you're seeing here is the national rate of children screening in for investigation, and the orange line is Colorado. So in 2021, which is the most current data we have available right now, 33, almost 34 children per 1,000 children in the population screened in for an investigation, a little bit lower than national. If you break that down to urban and rural, you'll notice that the rural groupings is a little bit higher than urban. You have a little bit more rural kids screening in for investigations than you do the urban population. The spread has narrowed a little bit over time, but you still have, but it's consistently been higher. And what really jumps out is this Black African American population across the board. This isn't split out by urban or rural. So 74 Black children per 1,000 children in the population screened in for investigation, which is about a little bit over double what you'd see for white and multiracial children. And it's been climbing, where the other populations have been either flat or more stabilized. So the slide we're looking at now is looking at the data by who's calling it in. I'm not showing all providers. We've narrowed it down just to a few, just to try to get less spaghetti on the screen. And what we did for this presentation is we broke it down to educators and childcare specifically, as well as keeping in the other top 2, which is the law enforcement grouping and the mental health groupings that we talked about some of those last time. But educators, you can see over time, make about 20% of the calls each year. It went up a little bit during the 2017 to 2020, but it's been averaging about 20%. Childcare is only about 1% over time. And so this is that piece where I was kind of surprised to see it so low, given some of Don's comments about the, we kind of call in everything because we need to call in everything per our either statute or by their policies and practices. Which could be that a lot of those get screened out. They just don't make it in for an investigation. So as I go through this presentation from this point forward, I probably won't talk about childcare really. We'll just kind of focus on educators because these numbers are so small. You get some data points that just kind of go kind of haywire, just the way math works with really small counts. So when you're looking at urban and rural and you're looking at educators, it's about the same, 20%, 19%. So it doesn't matter where you're located, educators call in about the same amount of, proportionally the same amount of calls. And you can see that educators by race and ethnicity, the far right graph, is Black African Americans are a little bit called in a little bit higher by educators, but it's not too far out of proportion to the other race and ethnicities that are in there. So how about the dispositions? So when a call comes in, it's accepted for investigation and there's a finding that comes out of that. So if you look at this, you'll see that all those that were called in, about 50% were unsubstantiated. You have about 27%, and it's been consistent over time, that's been substantiated. And your alternative response over time has slowly been increasing. And that's just kind of offsetting the unsubstantiated. So increasing the alternative response, decreasing unsubstantiated. And if I recall from the last presentation that over the last few years, more and more counties have been kind of incorporating the alternative response system into the practice. So we kind of expect to see this kind of increasing alternative response and decreasing of unsubstantiated over time. When you look at the rural versus urban section, you definitely see a very sharp increasing of this alternative response over time. I don't know how the rolling out of alternative response works, but maybe a lot of these rural counties are receiving alternative response interventions more readily, faster than you're having some of the urban counties happening. So that could be reflecting some of this piece of it. And when you look at just the Black African American population, alternative response for Black African Americans have been going up slightly. You have a slightly decreasing of the unsubstantiations and so it's been relatively flat. You don't see any marked change like you see with some of the other populations, specifically the white population. You see the alternative responses. You have a white population definitely have more and more going to alternative response. And you have, compared to the multiracial, which is relatively flat, the Latinx, which is relatively flat, and the Black African American that we saw also. So this is just kind of it takes a second to orientate yourself that how you read this chart is this left-hand column you have going down is percent of all of the reports in 2021 that were screened in, who made those. And so educators, we saw in a prior graph, made 20%, childcare made 1%. And then of those, of the 20% of the educators, what was the finding that happened from those? So, and that's what these three bars, how they split. So let's first just kind of talk about the substantiated pieces of it. And you can see predominantly substantiation is coming out of the law enforcement legal section, and only about 14% of all the educator calls are substantiated. You have pretty equal distribution across everybody going to alternative response. So about all the reporter types are being screened in for alternative response findings. And same as the unsubstantiated, relatively equal distribution across the top. If we want to think about educators specifically, of all the reports by educators, a little bit over half are unsubstantiated, about a third are go to alternative response, and about 14% are substantiated. So they call in a good chunk, 1 in 5, but only 14% of those are substantiated. So vast majority go into the alternative response or unsubstantiated type of categories. So now we're going to look at the data, similar graphs we looked at, but these are calls only by educators and childcare professionals. So before we were looking at, doesn't matter who it went to, these are just now specific to the educator childcare call-ins. As we saw, 20% were called in by reporters, 1% by childcare. We saw the very similar distribution of rural and urban, very similar. And you don't see a lot of difference between race and ethnicities in here. And here's you see a lot of jumping by childcare because you have a really small denominator count. So really, you have a slight change, you get a big jump that happens. So the disposition by the childcare and educator focus people, of the educators, 52%, we mentioned that in that prior slide, 36 and 14%, kind of this is where they're going. You're seeing of educators, a slight increasing of the alternative response and a slight decreasing of the unsubstantiated. We kind of expect that given the other data, and that's kind of a flow we would kind of expect with the rollout of an alternative response system. Rural and urban look at this data. we saw similar patterns. We have a sharp increase in the rural for alternative response, as well, and the urban is relatively flat. And then by race and ethnicity, you have for educators, you're seeing a little bit more increase of the Black African American response going to alternative response. If I recall from the earlier slide, for as a general feeling, the Black African American is more flat. So you're seeing a little bit more of the educators going into alternative response for the Black children. You can also break the data down by the specific type of allegation. So what we're looking here is same flow chart, but we're looking at just any report that included allegation of neglect. Educators make up 17% of the neglect allegations. Before it was 20% as all, but 17% of the neglect allegation. And you can see kind of where they distribute and where they go. When you look at physical abuse, educators make up 30% of all of the reports that include a physical abuse allegation. But even a higher percentage are unsubstantiated, about 62%. So they're calling in a lot more physical abuse. They're unsubstantiated even a little bit higher rate than as a whole. If I remember correctly, it was like 51, 52% were unsubstantiated as a general. When you get down to sexual abuse, our percentages drop. So they're only calling about 12%. Most of those are being unsubstantiated. Medical neglect, they call in about 18%. And then emotional neglect, they're calling about 17%. So looking at this data for 2021, is the physical abuse allegations is where they tend to make the most impact on what they're calling in. And I'm looking at time, so I'll go through these slides relatively quick. There's only a few extra ones, and you can find these slides on the PowerPoint if you want to go a little more deeper. We're looking at those particular allegation types that we saw before. So these are all calls by reporter, by educators, with a medical neglect, with a general neglect, with a physical abuse, and we'll go through each of those slides. So it's just kind of dissecting that prior slide we saw a little bit into rural and urban, etc. So the rural tends to call in more medical neglect than urban areas, and we'll just kind of focus on the locality aspects of it for time. Sexual abuse, there was a spike for a little bit, for a couple of years, that dropped back down, pretty even in terms of rural and urban. They're calling it about the same rate. Physical abuse, which was the highest, it has been declining. So even though we saw 30% in 2019, they made up 35% of the calls. So there's been a little bit slight decline on physical abuse call-ins. But who's calling them in by locality, about the same. But the driver on the decrease is the urban. But we'd expect that. More calls come in from the urban counties than they do. So they're going to drive this overall. And the unsubstantiated, they're about the same kind of patterns in terms of the findings also. Similar. General neglect had been increasing over time. So we show 17%, but they were only calling back 14% back in 2015. So it kind of a decrease of physical abuse, more of general neglect. Maybe it's just a way that the state through policies changed some of the coding or the meetings. So maybe some of that overlap is kind of going in here. Similar patterns between the two. And that is it.
Awesome. Thank you, Steve. So that was a lot. But I love how you called out some of the changes or differences when we looked at like overall versus diving into a particular class of report, be it general neglect or medical neglect. But I want to open up the floor for any comments or questions that folks have, any reflections as we think about the tying the data to the conversations that we just had. We'll just open up the floor. We know that this is a chatty group, so.
So I just want to note that once again, it looks as if there is a greater rate take up for alternative response for white families versus families of color. So I think that's a note. And once again, I want to say, we know alternative response is often of really more easier path for families to engage with, and take the good practices that you're working on and that you're developing and use them to your benefit to kind of bring some equity. Think about it that way.
Thank you for that, Crystal. You'll also recall that in rural communities, alternative response had a much higher rate than in the urban areas. And I'd be curious, there were a couple of you that named some of the unique challenges and experiences in rural communities. But I'd be curious whether you're seeing with your relative perspective and with the individuals, providers, and so forth that you talk to, if you're seeing that same pattern play out.
And Ida noted Denver and Adams, two major metro counties, are just now in the process of getting started on AR.
Awesome, thank you. That's important context to have. Was the data overwhelming?
Seeing Margaret's hand up. Margaret, go ahead.
So just help me understand, as we talk about alternative response, reporters have no say with respect to what is going to happen once that report is made. Can you help me connect why we need to focus on that in this group?
So the reason that I brought it up is because I love to look at the way things are working well and to say, how can you help to right size all the practice when you've got something that's working well? Just as if I noticed when we looked at where kids were placed, it shrunk around use of kinship for the kids of color. And so I just think if you've got good practices, let's look at those good practices to see if you can build on them. And I realize that mandated reporters don't have that choice. So it's well put, although the agencies have to build partnerships in the community to make alternative response work well. So you do have a role that way, just not for the decision point.
Yeah, I think the other thing to me that makes looking at the data around alternative response helpful in this mandatory reporting context is that it suggests that there are needs for the family that don't require the level of intervention that might be necessary for a child abuse and neglect referral. And so we think about mandatory supporters. We've had a lot of conversation around that today. When we think about mandatory supporters, potentially, if that kind of approach was developed, some of what is being reported as child abuse or neglect being routed through alternative response could potentially have a completely different pathway for mandatory reporters or for reporters. So I think it's helpful as a proxy for thinking about the population of kids and families that might be appropriate for a different response than reporting to a child abuse and neglect hotline as it stands today.
And can I just also note that one of the things that Steve pointed out is that your general neglect, the rate of general neglect calls is going up. And is that alternative response? Whereas the physical abuse calls were going down. And I think that's important for this group to think about when you're thinking about policy. What's your definition of neglect?
Thank you for that, Crystal. And I see Donna put in the chat that support cannot be one size fits all. It has to be, oh, now my box is moved. But that it can't be a one size fits all. Donna, you want to come off mute and sort of chime in and add a little bit more color to your comment?
Yeah, what you missed, Doris, is it needs to be focused on equity and not equality. And I think we get stuck on that as well in this system. Like, let's give everybody the same thing. No, that is equality. We don't all need the same thing. We all need something specific in order to, you know, increase our ability to be safe and prudent parents or whatever that is, right? Like you give every family, and I think you all talked about this on the panel, having those poignant conversations with each family to figure out what are the individual nuances to their situation that will help to, alleviate some of their stressors is so essential. So it's not about giving everybody the same thing. It's about making sure everybody has access to what they need. That's equity.
Thank you for that, Donna. And I think that the data helps us to figure out like where we could be looking deeper to better understand the actual circumstances of the kids and families that fall into a particular at a particular data point. Any other reflections, comments, or questions?
Seeing Michelle's hand up.
Hi, I think it would be important for folks to understand the guidelines of what gets accepted into differential response and what doesn't. Counties are given an agency response guide to help them understand what should be a differential response and what shouldn't be. And I also think it's important for the group to understand that not all families that get reported to the child welfare system fall under what we call Program Area 5, which is child maltreatment, that those families who are reported for purposes of youth services or what we call Program Area 4 don't qualify for differential response because that system is not set up to accept it as differential response. So these are kids who are court ordered into our custody or for investigation for placement in services, truancy court, kids who are inside the juvenile justice system that then get reported into the child welfare system don't qualify for differential response. And so I think that there's important caveats to understand about that before thinking about why some families do not receive differential response. I hope that makes sense.
That makes perfect sense. And I think it potentially comes back to some of what Crystal said in terms of looking at disproportionality and access to alternative response in Colorado as well. Lori, I see your hand raised.
I'm sorry, I've been in and out, but I guess my comment for this is that, in our area, what we find is that a lot of our cases are unfounded because the mandatory reporter isn't reporting everything that they heard or saw or were told because they're trying to protect the family. So what I thought was interesting is that in some of those slides, you saw that there was a high rate of unfounded cases based off of who reported them. And we find that in our county too. Like if our teachers are reporting or our school districts are reporting, a lot of those are going unfounded. But my concern is that, are they really unfounded, or are we just not educating our mandatory reporters on what needs to be reported? We had a case where a kiddo, it was reported that she smelled like sex. Well, what does that mean? And I work with children who are sexually assaulted every day, and that's not going to get screened in because that doesn't mean anything to that screener. We need to, I think, educate people on how to report it when they do really have a concern as well, not just to report it.
Thank you for that, Lori. That actually, your commentary, I think is a great way to kind of bring us back to what we heard by way of theme from a lot of you today around the statute today is very specific and doesn't leave room for gray judgment, asking deeper questions, and sort of making a decision when you're talking about professional reporters reporting. And also the need for there to be a greater opportunity for nuance in developing these important professionals who are working with kids and families to do some of that deeper engagement work to better understand the circumstances and make decisions that use critical analysis and understanding of the kid and family, and making referrals that that I'll just say sort of make sense. So you kind of brought us back to some of the themes that we heard, and that we also see playing out in the data. And looking forward to some additional discussion on these topics from other professionals in the space, and continuing to flesh out the themes that are surfacing across professionals, and also any nuances that might vary. Thank you for your time today. It's been a pleasure having what I think has been a rich discussion, and what will be a continued rich discussion around the ways in which professionals engage with kids and families and make reports, and the challenges and opportunities that lie.
Thanks, Doris. All right, y'all, I'm going to, we're not, that was a good closer, but we're not closing yet. We do have one public comment. Stephanie, we've got 3 minutes for you. I know you put a comment in the chat. I just want to note that the task force doesn't have an opportunity to respond to the question, but we'll make note of the question as they hone in on their recommendations to consider kind of the feedback and the idea that you're suggesting here. So Stephanie, if you wouldn't mind for the record, introducing yourself, and you've got 3 minutes. Go ahead.
All right, 3 minutes, here we go. My name is Stephanie. I work in the QA department for our statewide crisis hotline. So we do telephonic crisis work, and my question kind of falls in if there is any potential discussion for first steps, perhaps being something like a mobile crisis unit, as an example, to potentially assess the things that we cannot see in telephonic crisis work. So allegations of abuse or neglect that are coming in telephonically, and then perhaps sending out somebody who could visually see what's actually happening in the home as kind of a first step. So my question was, versus calling in that mandated report based on the information provided telephonically, and CPS being, that first step of potentially sending in a mental health professional, some kind of clinician to assess what we're hearing so that we're taking the right steps as far as reporting goes telephonically.
Thanks, Stephanie. Really appreciate you being here and appreciate your ongoing engagement. We'll make note of that. Yeah, we'll make note of that for the task force as they move forward and some of the recommendations and the how piece further down the road. So really appreciate your time there. I'm going to drop in just as a reminder for folks where we're headed. We've got another meeting coming up quick, just based on how things kind of fell in July with the holiday. So August 2nd, we're back. We've got the continued conversation around who makes the calls. We're going to focus on 2 panels again, advocacy panel and legal law enforcement panel. And then in September, we'll be kind of shifting into the who receives the calls. So members who are present, who are on the receiving call end. So just wanted to remind folks of that. Send me a note if you are not planning on being here for the August 2nd meeting. And you should, if you don't see the calendar invite. Stephanie, I'm going to hand it over to you for any closing remarks as chair, and then we'll get folks out of here on time.
Yeah, just my thanks to all of you. Honestly, what a rich conversation. Really exciting one too. So just thank you for sharing your ideas and your time, and honestly, authentically engaging here. Really, it matters very much. So just very grateful. Thank you.
Great. Thanks all. Okay, we will see you August 2nd. Everyone have a great rest of your day. Thanks again.